What if everything you thought you knew about health insurance was a lie? What if the one thing we believe protects us from financial disaster actually pushes millions into bankruptcy every single year? Imagine paying premiums for years, doing everything right, and still watching medical bills ruin your life. That's not rare, that's reality. And today, we're going to uncover the hidden truth your insurer doesn't want you to see. Before we dive in, hit like, subscribe, and turn on notifications, because this could change the way you think about healthcare forever. Health insurance is marketed to us as a safety net, something that steps in when life hits us with sickness, accidents, surgeries, or emergencies. You pay monthly, you follow the rules, you get coverage when it matters. That's the promise. That's the story we all believe. It sounds simple. You trade predictable monthly payments for protection against unpredictable medical costs. But here's the question. Does it actually protect you when it counts? Because according to studies and financial data, something astonishing shows up again and again. Nearly 3/4 of all medical bankruptcies happen to people who had health insurance. That means most people who go bankrupt from medical bills were insured, not uninsured, not careless, not reckless. They did everything they were supposed to do. Here's where it gets controversial. When you need care, you file a claim with your insurance company. That's just how it's supposed to work, right? But in reality, submitting a claim is only the first step in a battle you might not win. Your claim gets denied. The procedure is not medically necessary. The billing code is unapproved. You're told you saw the wrong specialist. These are real reasons insurers give, and you'd be shocked how often this happens. Let's break it down. Some insurers deny up to 1 in 3 claims, even when the care was in-network and recommended by a doctor. Even with in-network providers, legitimate claims get rejected. You might think, well, I'll just appeal. But here's the ugly truth. Less than 1% of appeals succeed. That means most people never get the coverage they were promised because the system is too hard to fight. It's not incompetence, it's a built-in feature of the system. Here's one of the most frustrating things people rarely talk about. Most insurance plans have something called an out-of-pocket maximum, the most you're supposed to pay in a year before insurance covers everything. Sounds fair, but here's the catch. If you get sick in October, hit your maximum by December, and then continue treatment into January, your out-of-pocket expenses reset. Meaning what? You start paying all over again for the same illness in the same policy year. It's like having a safety net that magically vanishes every January 1st. This is not hypothetical, it's real, and it's surprisingly common. It turns a serious health crisis into a multi-year financial burden. Let's address the core and controversial concept. Health insurance companies are not designed to prioritize your health. They're designed to maximize profit. Think about it. You pay premiums every month. They earn money whether you use services or not. Every claim denied is money saved. So when you hear a denial rate of 20% or higher, that's not a glitch. That's a business model. They're not your partner. They're not your advocate. They're a middleman with a bottom line. And that bottom line improves when they pay less in claims. Let me give you a real-life picture. Picture a family. Let's call them the Johnsons. Mrs. Johnson gets sick in November. Multiple tests, specialists, a long-term treatment plan. They hit their out-of-pocket maximum. They think they're safe. But January comes, new year, new expenses. Same illness, same treatment, but new deductible. And suddenly, the bills pile up again. Or consider this. A young man breaks his arm playing soccer. He goes to the ER. His claim is denied because the insurer claims he could have used a lower-cost facility, even though the ER doctor referred him. He spends months fighting it, digging through paperwork, missing work due to stress. This isn't exaggerated. This is the experience of thousands of Americans every year. So you might be asking, if the system is broken, what can I do? Here are real-world steps people can take. Understand your plan details inside out. Many people don't know the difference between deductible, coinsurance, and out-of-pocket max. Keep detailed records, medical, bills, appeals, notes. This becomes crucial in fighting denials. Get help from professionals. There are advocates, lawyers, and patient assistance programs that specialize in appeals. Shop smart and early. Not all plans are equal. Know the networks, know the caveats. Ask for price estimates before treatment. Yes, this works. None of these are perfect fixes, but each one gives you more control over a system that feels stacked against you. Health insurance wasn't supposed to be a game of chance. It was supposed to be a safety net, a buffer between you and financial disaster. But for far too many people, it becomes a gamble, a bureaucratic maze, a financial burden instead of protection. So ask yourself, that card in your wallet, is it a net or a ticket to a game you never signed up for? If this video opened your eyes, like this video, subscribe for more deep dives, and share it with someone who's paying too much for healthcare. Leave a comment below. What experience have you had with insurance denials? Tell your story. I read every comment. And while you're here, click the next video that just popped up, because there's a lot more we need to talk about. Thanks for watching, and I'll see you in the next one.